My name is Dr. Ishwar Bohra. I am a senior consultant working as a joint replacement and sports medicine specialist in BLK Super Specialty Hospital, New Delhi. Today I am going to tell you about which is most common problem in our country is the knee pain. It is a kind of epidemic in our country. So what makes knee pain? Knee pain is where patient get aged, means aging is started. In younger patient there is arthritis like rheumatoid arthritis, gout or other inflammatory arthritis, or patient having the any accident which lead to the arthritis. So that population of knee pain patient become arthritic. So they need some kind of intervention and we can try to give them pain-free mobility. So this is the knee. I want to explain on the model so you can understand in reasonable way. So these three bones make the knee joint. This is the thigh bone, this is the leg bone, and this is the front bone, kneecap. So these three bones make a knee joint. Two sides are the support and these two are the cushion inside. If you can see, there is a glistening layer which is known as a cartilage. So with age or by injury or by the other medical condition which lead to damage to this cartilage layer, then arthritis setups. What are the symptoms of arthritis? How patient will come to know that I have the arthritis? So first and foremost important sign is the pain while the walking or the load bearing, or pain during the daily activity like climbing the stairs, getting in and out from the car, or sitting in one position and the patient have stiffness or pain. So these are the few signs where patient thinks that yes, I have some problem in the knee and I have to consult the doctor. Then we come to the diagnosis, how you can diagnose. So by clinical history means what patient says, like I have pain while walking, I have pain while long sitting, pain while getting in and out from car, pain while climbing or down stairs. So these are the preliminary symptoms. Then we investigate the patient. So first investigation is the X-ray. So by getting the X-ray, we can check the status of the cartilage by assessing the joint space. So if you see the knee joint, you will always find a gap between these two bones, which is the thickness of cartilage, which is indirect assessment of the cartilage health. If this cartilage is started wearing off or it is wear off, then this joint space become reduced. So then we say that yes, you have the beginning of arthritis or the advanced stage of the arthritis. So after diagnosing, what we can offer to the patient? If patient is younger and arthritis stage is not advanced, then we say yes, you can go for the physical therapy like physiotherapy, exercise, cycling, and some anti-inflammatory medicine and cartilage protective medicine like glucosamine, dicerine, and some form of injection hyaluronic acids. So these are the non-operative, non-interventional treatment for the knee arthritis. When patient doing these all therapies and patient is relatively older after age of 50 years and this symptom is not improving by these therapies, then stage comes where we need an intervention. So there are many forms of intervention. As I already told you, that is injection, then comes the arthroscopy, then comes the alignment correction surgery, this is known as a high tibial osteotomy, then proximal fibular osteotomy, and last operation is the total knee replacement. So we assess the patient and classify the treatment according to the stage of arthritis. In stage 4, which is the last stage of the knee arthritis, so total knee replacement is the only solution where all this medical therapy and physiotherapy doesn't work. So what is total knee replacement? Total knee replacement is to replace the dead cartilage in place of the dead cartilage. So it is a misnomer. It is not a total cut of the knee. So you can say it is a resurfacing of the knee joint. So if you see, when this cartilage become dead, so we replace this metal cap in form of the original cartilage. Same, it is a plastic cushion and metal tray which we use in the leg bone, and we reduce it, and this you can see it's like a normal pain free aligned knee joint. So there are many misconceptions about total knee replacement. Patients have many fears and myths about the total knee replacement, that after surgery whether it will be successful or whether I will able to walk like normally before the surgery. So nowadays it is a most successful surgery in the orthopedics. Total hip replacement and total knee replacement, both surgery have the maximum success rate up to 98 or 99%. For surgery, we admit patient for 5 days for the single knee replacement, and we evaluate cardiac and medical evaluation. If patient is fit, next day we can go for surgery, and then we keep patient for 3-4 days. After surgery, next day we allow patient to walk with walker and toilet training and corridor walking for 2-3 days. Then when patient become comfortable and reasonably pain free, we allow them to take stair climbing on 5th day, and slowly within 4 or 5 weeks patient can walk in the nearby park or at the open space, and end of the 3-month patient can drive, can swim, and other day-to-day activity he can perform. Yes, there are complications, like if patient have medical comorbidities, means there are any other medical disease patient having like diabetes, hypertension, thyroid, cardiac disease, asthma, osteoporosis, which are generally at age of 55 or 60 patients, some disease associated with the many patients. So we need to thorough evaluation of this patient, and pre-operative we guide the patient that yes, you have these associated problem, so you might need extra care for these conditions. Other risk factor are infection. In our setup like BLK Hospital, we have almost 0% infection rate. It include lot of efforts to make it good OT condition, maintaining of asepsis, and thorough evaluation before surgery. Other problem is the clotting of the veins, that is known as DVT, deep vein thrombosis, and after many years there is a sometime loosening of the implant. This implant become loosened from its bone surface, that is known as aseptic loosening, because implant has its own life up to the 15 to 13 years, depend on the category of implant and the condition of bone, like osteoporotic bone or healthy bone. In brief, we can say if you are a candidate for knee replacement surgery, no need to fear. It is a most successful surgery and kind of guaranteed surgery which you can transform your life with disturbed mobility to pain free and good walk. For more information, please visit our hospital website.
BLK Super Speciality Hospital, a passion for healing.